Tissue expander to implant exchange involves removing the existing tissue expander and replacing it for what is usually a silicone implant, but could be saline implant. So we're getting rid of the tissue expander and replacing it with an implant. This procedure is generally done through the same scar or incision as the initial mastectomies, meaning it doesn't add any scars to your breast to do the tissue expander to implant exchange. The tissue expander is removed. The pocket is adjusted if needed with capsulotomies prior to placing the silicone implants. Sometimes an internal Ryan flap may be performed to better position the inframammary fold or shelf for the future implant. Then the future implant is placed in the pocket and the skin is sewn up, and that is a tissue expander to implant exchange. Generally, no drains are needed. Oftentimes with this operation, fat grafting is performed at the same time to further improve the overall contour and symmetry of the breasts. Please refer to my videos about fat grafting to the breast to learn more information about that procedure and recovery. And to learn more about the recovery following tissue expander to implant exchange, check out my video that summarizes the recovery. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.